So on to sleep apnea. They may ask us a question about sleep apnea because now we find out that this is a pretty common disease also. So there's two types, but I want you to know one specifically because this is the one that's most important. And I've got it here bold right here. Obstructive sleep apnea is the most important one that you have to know because it makes up about 95% of all sleep apnea cases that we see. Then there's central sleep apnea, right? But the one that is most important, and I'm going to talk to you extensively about, is obstructive sleep apnea. Now, obstructive sleep apnea, basically these patients have some obstruction up here, right, in the upper respiratory system. Their airways seem to be floppy. They seem to be obstructive and floppy. And what nighttime does, what sleep does, it makes them more floppy. It makes them actually kind of collapse together and obstruct the airways even more. That's what happens in sleep time. Sleep is a permissive thing here, where these people have small airways, obstructed airways, floppy airways. They go to sleep, they become more floppier, they collapse more. So the patient that has obstructive sleep apnea goes to sleep, their airways collapse, they close up, right? All of a sudden, you know, they become hypoxemic, right? They wake up to get a breath of fresh air because they're hypoxemic. This vicious cycle happens 500 times a night. That's the definition of obstructive sleep apnea. So during the night, multiple waking up because of a drop in PO2 and a rise in CO2, and this happens 500 times a night, all night long. The next day when these patients wake up, of course, they're sleepy, they're in your office waiting for you, they're sleeping outside your office, you're in a meeting, they're sleeping in the meeting, and so forth. So the cessation of airflow happens at least 10 to 15 times per hour. Like I said, it may happen like 500 times during the night. The O2 saturation increases, the pulmonary pressure increases, so this is a big deal. Because when it happens all night and it happens for years, these people get pulmonary hypertension. They get cor pulmonale. They get hypertension, peripheral hypertension. So this is not a simple disease. They develop, of course, daytime somnolence, and I told you about the hypertension and the cor pulmonale. And now here's they ask this. They give you a patient, and they tell you this patient is kind of obese, right? And he's got daytime somnolence, and this is what he comes to.